Many people assume that once they qualify for Medicare, their healthcare costs are generally covered. However, that's not always the case. With Medicare, things like hospital stays, doctor visits, and prescription drugs are typically covered to a certain extent. However, there are areas in Medicare that are not fully covered. Because what many people don't realize is things like vision, dental, hearing aids, and even long-term care is typically not covered by original Medicare. And so when those type of needs come up, they can actually add up quite quickly. And so in this video, I'm gonna walk you through what Medicare does not cover and what people generally do to help fill in those gaps and get a little bit of extra coverage in those areas that Medicare typically does not cover. Hey, my name's Eric. I'm a licensed Medicare agent, and if you want to try to avoid unwanted or unexpected healthcare costs, there's a couple important things to understand about how Medicare works. First off, Medicare isn't the same as health insurance that you may have had through your employer. Medicare is actually a federal program, and it provides reasonably strong coverage for things like doctor's visits, hospital stays, diagnostic tests, and outpatient services. And even though Medicare does cover quite a bit, there are still quite a few gaps that are important to understand before you run into them. And the first gap that original Medicare typically does not cover is dental care. Now, with original Medicare, things like routine services such as cleanings, implants, fillings, things like that are typically not covered under original Medicare. There are a few exceptions to this though. So for example, if a certain dental procedure is tied to like a medical issue that you have that is covered by original Medicare, in those rare circumstances, you might be able to get some dental coverage, but overall, your dental coverage with original Medicare is typically very limited. And so as you get older, your teeth start to maybe decay a little bit, you maybe need some implants, you need some fillings, extractions, you might have to pay for those out of pocket, and those costs can really add up. Now, many Medicare Advantage plans do have dental benefits, but those dental benefits often have like a maximum amount that they will cover for the year. So for example, maybe they would cover $2,000 over the space of a year for your dental needs. And then once you hit that maximum, anything you spend after that is gonna have to come out of your own pocket. So again, they're only going to cover typically up to a certain amount. So the key takeaway here is simple. Original Medicare typically does not cover your dental procedures. Medicare Advantage plans typically do offer dental benefits, although those benefits are often limited. Now, the next gap that people often see in Medicare is their vision needs. Original Medicare typically does not cover routine vision services. So things like eye exams, glasses, or contact lenses are typically not covered under original Medicare. And so if you need any of those things, a new prescription, new glasses, things like that, you will have to often pay out of pocket. And when you add up things like glasses, contact lenses, even vision exams, these things can add up to several $100s or even, thousands of dollars in a given year. There are some caveats to this though. So for example, if you have a certain condition like diabetes, then original Medicare may cover certain types of eye exams that are related to your diabetes. Cataract surgery is also typically covered with original Medicare, and in some cases, they will even provide you with lenses after your surgery. But outside of those specific unique medical situations, original Medicare typically does not cover routine vision services. Now, with that being said, many Medicare Advantage type plans do offer vision benefits that can be useful to many people. So for example, many Medicare Advantage plans do offer coverage for things like annual eye screenings, vision exams, and they will even offer oftentimes for like a certain amount of money you can spend per year for things like glasses, contacts, and things like that. So as you age and vision becomes more of a concern for you, it's important to keep in mind that original Medicare might not cover everything you need for your vision. Now, the next gap in original Medicare is something that actually surprises a lot of people, and that's that original Medicare typically does not cover long-term care. So what that means is that if you ever reach a stage in your life where you need consistent care, such as, help bathing, help dressing, maybe feeding yourself, etc., those kinds of needs are typically not covered with original Medicare. So things like assisted living facilities, long-term nurse care, or in-home support, those types of things will typically not be covered under original Medicare. And the reason for this is that Medicare is designed for medical care, not for custodial care. Now, just like the other needs we talked about, there are some caveats to this. So for example, if you had a qualified hospital stay and you need to stay in a skilled nursing facility for a certain amount of time, Medicare may cover a portion of that. But again, this is meant for recovery and rehabilitation, not for long-term support or care. And coverage for these stays is typically strongest at the beginning and usually decreases over time depending on how long you stay at these facilities. And this gap in long-term care is one of the most important gaps to understand, because in retirement, it can actually become a major expense if you're not prepared for it. Now, the next thing we're gonna talk about is something where Medicare does offer some coverage, but it can be a little bit confusing to understand how the coverage works. When it comes to prescription drugs, Medicare uses something called Part D. But being enrolled in Part D doesn't automatically mean that you have all your prescription drugs covered. Now, every Part D plan has something called a formulary, and all a formulary is a list of drugs that the plan will cover. And each plan has a version of that list, and so a medication that might be covered on one plan might not be covered on another plan, or may not be covered in the same way. And so when a medication that you're taking is not on your plan's formulary, you may have to pay out of pocket for that, unless you're involved in another program that maybe helps offset some of those drug costs for you. Now, there have been some recent updates on how prescription drugs are handled under Medicare. For example, limiting out-of-pocket spending for certain drugs. So if a certain drug is not listed on your formulary, those out-of-pocket limits may not apply in the same way. There are also certain situations where a certain plan may cover one version of a medication but not another. So for example, it may cover the generic version but not the brand name version of a certain medication. Another thing to keep in mind is that these formularies can change on a yearly basis, and so one medication that may be covered this year may not be covered next year, or how much is covered can change from year to year. And this is why it's always important to check in on your plan on a yearly basis, just to make sure that the coverage that you have this year is still gonna carry over to the next year. The next gap that people are usually surprised to hear about in Medicare are hearing aids. Now, typically hearing aids are not covered under original Medicare. And if you've ever looked into getting hearing aids or just been curious, you will see that hearing aids can actually be quite pricey. Now, the good news is many Medicare Advantage plans do offer limited hearing benefits, and a lot of times they'll offer like certain amounts that they'll pay yearly for hearing aids, hearing exams, and different things like that. Now, moving on to the next one, and this one might be a little bit more obvious, but original Medicare typically does not cover cosmetic procedures unless they are deemed medically necessary. So for example, if you have like an injury or an illness and you need some form of reconstructive surgery, that might be covered by Medicare. So now that we've touched on a lot of the most common gaps that we see in Medicare, I wanted to touch on now what people do to go ahead and plan for those different gaps within Medicare. So one of the most common things I see people do to go ahead and try to fill in some of those gaps left in original Medicare is opt for a Medicare Advantage plan, also known as Part C. And what these plans typically do is combine your medical coverage with additional benefits such as vision benefits, dental benefits, as well as drug coverage. And for many people, that convenience is really appealing. So rather than having your typical Medicare and then adding on maybe like dental coverage, vision coverage, etc., it's all pretty much bundled into one, making it a lot easier to manage. But like with most things, these additional benefits often have limits, and a lot of Medicare Advantage plans also have provider networks, meaning you can only see certain doctors or dentists, etc. You a lot of times have to stay within your network if you want to receive coverage. Another thing that I see a lot of people do is they will stay on original Medicare and then just add a Medicare Supplement plan, also known as a Medigap plan. And these plans are designed to help cover a lot of the out-of-pocket costs associated with Medicare, such as co-pays and co-insurance. And in many cases, these type of plans can make your medical costs more predictable, especially for Medicare-approved services. Now, although these type of plans typically offer more flexibility as far as like what doctors you can see, what hospitals you can visit, they often do not provide a lot of the additional benefits that Medicare Advantage plans do, such as vision coverage, dental benefits, things like that. So for people who choose these supplement plans, a lot of times they also have to add a Part D plan for their prescription drugs, and then other times they'll even add other type of plans for things like vision coverage, dental coverage, etc. And another thing to add with these plans is you're typically going to have to pay a monthly premium. Besides a Medicare Advantage plan or a Medicare Supplement plan, another common thing I see people doing is just paying out of pocket for these services. So if you're someone maybe who doesn't wear glasses, maybe you don't have hearing aids, but maybe you gotta go get a tooth filled or something like that, Some people just would rather just pay out of pocket rather than having to pay the monthly premiums. If something comes up, they just address it and pay out of pocket. So overall, it's important to understand what your plan covers, what it does not cover, and what you will do to fill those gaps or those holes that are in your plan. Medicare is a very solid foundation, but it does not mean that once you have Medicare, all your healthcare costs are covered. Now, if you already have a Medicare supplement plan or you're considering one, there's one more important thing that you should understand. Because depending on how it's set up, some people end up paying more for the same type of coverage. So in this next video, I'll walk you through how that happens and what to watch out for to make sure you're not overpaying.